Introduction. Hello and welcome. Today we are going to talk about the grading of tumors. When a person is diagnosed with cancer, one of the first things doctors will do is grade the tumor. Tumor grading is an important tool that helps doctors understand how aggressive the cancer is and how likely it is to spread. Let's take a closer look at tumor grading and what it means. Tumor grades. Tumor grading is a system used by doctors to classify cancer cells based on how abnormal they look under a microscope. The grading system ranges from 1 to 4, with 1 being the least aggressive and 4 being the most aggressive. The grading is based on 3 main factors. 1. The degree of differentiation. This refers to how much the cancer cells resemble normal cells. 1. Highly differentiated cancer cells look similar to normal cells, while poorly differentiated cells look very abnormal. 2. The mitotic rate. This refers to how quickly the cancer cells are dividing. 2. Cells that are dividing quickly are usually more aggressive. 3. The tumor architecture. This refers to how the cancer cells are arranged. 3. Some tumors are more organized than others, and the more disorganized the tumor is, the more aggressive it is likely to be. Tumor grade 1. Tumors that are grade 1 are the least aggressive. They are well differentiated, which means the cancer cells look similar to normal cells. The mitotic rate is low, and the tumor architecture is relatively organized. Grade 1 tumors are often slow-growing and less likely to spread. Tumor grade 2. Tumors that are grade 2 are moderately differentiated. The cancer cells are somewhat abnormal, and the mitotic rate is higher than in grade 1 tumors. The tumor architecture may also be somewhat disorganized. Grade 2 tumors are more aggressive than grade 1 tumors, but they are still generally slow-growing. Tumor grade 3. Tumors that are grade 3 are poorly differentiated. The cancer cells look very abnormal, and the mitotic rate is high. The tumor architecture is often disorganized. Grade 3 tumors are more aggressive than grade 2 tumors, and they are more likely to spread. Tumor grade 4. Tumors that are grade 4 are the most aggressive. The cancer cells are highly abnormal, and the mitotic rate is very high. The tumor architecture is usually very disorganized. Grade 4 tumors are fast-growing and very likely to spread. Conclusion. Tumor grading is an important tool that helps doctors understand how aggressive a cancer is and how likely it is to spread. If you or a loved one has been diagnosed with cancer, understanding the tumor grade can help you and your doctor make informed decisions about treatment options. Thank you for watching, and we hope you found this information helpful. Introduction. Hello and welcome. Today we are going to talk about TNM staging. TNM staging is a system used by doctors to describe the extent of cancer in a patient's body. It is a way of classifying cancer based on 3 factors: the size of the tumor, the involvement of nearby lymph nodes, and the presence of metastasis, which is the spread of cancer to other parts of the body. Let's take a closer look at the TNM staging system and what it means. TNM staging. The TNM staging system uses 3 key pieces of information to classify cancer. 1. Tumor, T. This refers to the size and extent of the primary tumor. 1. The T category ranges from 0 to 4, with 0 being no evidence of a primary tumor and 4 indicating a large or invasive tumor. 2. Lymph nodes, N. This refers to the involvement of nearby lymph nodes. 2. The N category ranges from 0 to 3, with 0 indicating no lymph node involvement and 3 indicating extensive lymph node involvement. 3. Metastasis, M. This refers to the presence or absence of metastasis, or the spread of cancer to other parts of the body. 3. The M category ranges from 0 to 1, with 0 indicating no evidence of metastasis and 1 indicating the presence of metastasis. The TNM categories are combined to form an overall stage, which ranges from stage 0 to stage 4. Stage 0 is the earliest stage, and stage 4 is the most advanced. Primary tumor, T. Tx, main tumor cannot be measured. T0, main tumor cannot be found. T1, T2, T3, T4 refers to the size and/or extent of the main tumor. The higher the number after the T, the larger the tumor or the more it has grown into nearby tissues. Ts may be further divided to provide more detail, such as T and TEB. Regional lymph nodes, N. Nx, cancer in nearby lymph nodes cannot be measured. N0, there is no cancer in nearby lymph nodes. N1, N2, N3 refers to the number and location of lymph nodes that contain cancer. The higher the number after the N, the more lymph nodes that contain cancer. Distant metastasis, M. Mx, metastasis cannot be measured. M0, cancer has not spread to other parts of the body. M1, cancer has spread to other parts of the body. TNM staging example, let's take breast cancer as an example. A person with breast cancer that is 2 centimeters in size, has spread to one nearby lymph node, and has no evidence of metastasis would be classified as follows. T. 2 centimeters, T2, N. 1 nearby lymph node involved, N1 M. No evidence of metastasis, M0. The overall stage would be stage LIA. Treatment and prognosis. The TNM staging system is important because it helps doctors determine the most appropriate treatment options for a patient. Treatment may include surgery, radiation therapy, chemotherapy, or a combination of these. The TNM stage also gives doctors an idea of a patient's prognosis, or their chances of survival. Generally, the earlier the stage of cancer, the better the prognosis. Conclusion: TNM staging is a system used by doctors to classify cancer based on the size and extent of the primary tumor, involvement of nearby lymph nodes, and presence or absence of metastasis. The TNM stage helps doctors determine the most appropriate treatment options and gives an idea of a patient's prognosis. Thank you for watching, and we hope you found this information helpful.